Hi, my name is Radeep, and today I'm going to be doing the tracheostomy care skill. Before I begin this procedure, I would just like to show that I don't have any artificial nails. I'm not wearing any jewelry. The first step that I would do when completing this procedure is I would walk into the patient's room. I would pull the curtain for privacy. I would introduce myself to the patient. I would identify the patient using two identifiers, and then I would go over the procedure to make sure they have a good understanding of it. So once I have done that, I would put the position into the appropriate position. So I would put the head of the bed into Fowler's position. I would provide suction and oxygen if needed. And then after that, I would just like to go over the supplies that I have. So I have my clean gloves right here. I have my tracheostomy care tray, which includes all the supplies that I need in order to do this procedure. So I'm just going to open it right now. I have my sterile gloves, but I'm going to set them off to the side because we don't need them right now. And then I have my sterile field. I'm going to grab it by only touching the outer border. Next, what I'm going to do is I'm just going to dump my supplies onto the middle of the sterile field. And then the next step is I'm going to perform hand hygiene. And then I will don clean gloves. So now that I have my clean gloves on, I would just like to say that in the tracheostomy care tray, I have my sterile normal saline, I have my hydrogen peroxide, the sterile solution that we'll be using to clean our supplies. What I will do next is I will take out the inner cannula, and I want to make sure that I'm keeping the tracheostomy itself stabilized while I'm taking it out. So now that I've taken out the inner cannula, I'm going to soak it in the sterile solution. The next step is I'm going to discard our old dressing because we will be replacing this with a new one. So this will be discarded. And then the next step is that I will be removing my clean gloves. I will perform hand hygiene once again. And now I will don my sterile gloves. So I have my sterile gloves right here. And in order to put on my sterile glove, I've already done hand hygiene. So what I will do is I will go underneath the first glove, and I'll have my hand in this position with the thumb on the inside to make it a little bit easier. We want to make sure that we're not touching the outside of the glove because then we break sterility. So what I will do is just like this, we can touch the inside. And just like that, we have our first glove on. So now that this glove is sterile, in order to put on our second glove, we can go underneath the cuff. So in this motion right here, it makes it much easier to put on the second glove. And again, I'll have my thumb on the inside of my hand to make sure it is not in the way. I will go underneath the cuff in this motion. So I have put on my gloves. We have our sterile field that our gloves first came in. We don't need that. If it's in your way, you can discard it using your elbow, but it's not in my way, so it's fine over there. So the next thing I will do is I will just organize my supplies and take a look at what I have. So this is the brush that I will be using to clean the inner cannula of any secretions. We have our new dressing, we have gauze, and then we have our sterile swabs, and we also have our new ties. So what I will do is I will grab the sterile swabs. Now we'll place these into the sterile solution. Our inner cannula has been soaking for a while now, so we can grab it. We can use this brush to clean our inner cannula of any secretions. So now that we've done that, we will place it back into the sterile field. Place it back into the solution. We can grab it once again, and we will be inserting it back into our cannula. We want to make sure that once again we're stabilizing it to avoid dislodging. So now that we have put our inner cannula back in, what we will do is we will grab our sterile swabs and begin cleaning the skin around the stoma. While we do this, we want to make sure that we're 5 to 10 centimeters away from the stoma. And we will also use this opportunity to inspect the skin around the stoma for any signs of skin irritation, and we will inspect the stoma itself for any signs of infection. So I'll grab my swab, clean, discard, clean, discard, discard, and discard. So the next step of our procedure is we are going to be replacing our dressing. So as you saw earlier, we did discard the old dressing, so I have my new dressing right here. Okay, we have just put our new dressing on our patient. The next step of this procedure is we still have our old ties in place. So we are going to be discarding our old ties, and we will be replacing them with new ties that are placed on the sterile field right now. So we will be discarding our old ties. And then our next step is to put on our new ties, and we will be using the one tie method. When we are doing this, we want to make sure that we don't apply the ties on too tightly, because that can cause suffocation, it can cause skin irritation. And then towards the end, we will, instead of using tape, because that can cause skin irritation, we will be using gauze as the padding to protect the skin. So what we will do is we will insert our ties through the tiny holes. And then we will use the one tie method to secure our ties. And then the next step of the procedure is I will be using gauze as padding, and I will place it underneath the ties just to protect the skin barrier. So now that we have replaced our ties, we are done with this part of the procedure. So if needed, we will provide the patient with an oxygen source, and then we will put the bed back into a comfortable position for the patient. We will lock the bed wheels. We will provide the patient with a call light, make sure it's within reach. So now we can take off our gloves, perform hand hygiene once again, and then the last step of our procedure is to document what we did. So we did tracheostomy care. If we notice that there were any signs of irritation or any signs of infection, redness, discharge, the patient was complaining of pain, we would document those findings into our e-chart. And then once we've done that, if there were any concerning findings, we would also notify the provider. But for now, that concludes the procedure. Thank you for watching.